Hi, my name is Lynn Rosenthal. I'm an Occupational Therapy Assistant student at Maria College, and I'm doing a project for school where I'm going to explain how you can prepare for lower extremity surgery. So these would be surgeries either on your knee or your ankle or your foot. And there's many things that you can do to get ready before you have the surgery to make your life easier once you come home. Often these surgeries are day surgeries. That's what I'm going to be talking about primarily, is what you can do in your home ahead of time to get ready so that when you get home after day surgery, life will be a little less stressful. So this video will cover things like how to walk around in your home with either a walker or with crutches, how to make a meal for yourself or for a child or to feed a pet, how to set up a station in your home for the first few days that will all be on one level, that you will be able to have access to all the things you need, and also how to get to the bathroom safely and how to shower or bathe yourself safely. So those are a few of the things that the video is going to cover. So the first thing we're going to show you is how to get around using a walker. A walker is a device that would be used by people who need extra help with their balance. So they might, instead of using crutches, which a lot of people would use once they come home from a day surgery experience, those people who need extra help with balance would probably be better off using a walker. And this might be somebody who has multiple sclerosis or an older person who's just not that flexible or that coordinated to be able to manage crutches. So the gait pattern, or the way that you want to walk with a walker, is to put the walker forward first, about a foot, keeping your weight on your good leg. Then you're going to put your surgical leg forward underneath the walker, and keeping all of your weight on your arms, you're going to bring your good leg or your strong leg forward. And that's how you use the walker. So once again, the walker first, then the surgical leg, and then your strong leg comes forward. It's very important that you make sure the walker is set at the right height. So in order to keep it at the right height, you want the arms to be at about a 20-degree angle. So you can see that once you're in position under the walker, Greg's arms are at about a 20-degree angle, and that's to help him use his arm strength to hold up his body weight. And also his hips are at about the height of the walker, so that's another guideline to make sure to use. It's tempting sometimes when you're using a walker or crutches, if you see something on the floor, to just think that you should bend down and pick it up. But that can be really a problem. You can fall very easily. So the best idea, if you're the kind of person that wants to always pick things up, is to make sure you always bring a reacher with you. And the reacher can be a very handy tool for a lot of reasons. But here, let's just pretend that we see this towel and it's in our way. So we're just going to use the reacher to pick up the towel, and then we'll just put it aside. And now we picked that towel up safely. A good idea to help you remember what the order is for using a walker is to put a little sign on it before you go and have your surgery. After you come home from surgery, your helper, whoever is going to be your caregiver, may not know the proper order even though you've been instructed in it before. And you may be a little bit foggy about what the order is because you're going to still be under anesthesia. So just put a little sign on your walker, and that way everybody will know what the order is for walking. The other thing that's very important when using your walker is to know how much weight you should bear on your surgical leg. And your doctor's going to tell you this, and your physical therapist, if you see one in the hospital, will tell you this as well. So I'm going to show you what it looks like if you're told not to put any weight on your surgical leg. So what's going to happen is, again, the walker goes forward first, and then your leg should be totally off of the ground. So no weight at all on your leg, all weight on the arms, and then move forward with the strong leg. So you're basically just kind of hopping. Now, the other thing that you might be told is that you could do a toe touch. So for toe touch, you're going to bring the walker forward. Then you can kind of touch just your front toe for balance, and then bring your other leg forward. And then the third way is that you could possibly be told is that you can do weight bearing as tolerated, which means you'll put as much weight as you want on the surgical leg and move forward, but you'll still use that same pattern. Surgical leg, you can put some weight on it, and then your other leg. Okay, so now we're going to show you how to get into a chair with your walker. So you're going to approach the chair and get as close as you can to the chair. And then you're going to just pivot around, and so that your back is facing the chair. So you just carefully pivot around. And it's a really good idea if you can use chairs that have armrests. And here's why. Because when you sit down, you're not going to be holding on to the walker at all. You're going to reach back and feel for the armrests or the bottom of the chair, and then sit down using your strong leg. This is a reason why it's really important to work your leg muscles prior to surgery. Now, getting up, what you're going to do is you're also going to stand up totally using the armrests and your strong leg. You're not going to reach for the walker. You're going to just stand up, and once you're standing, then you can reach for the walker. Please see additional videos on how to use crutches, how to set up a main station, tips for using the shower, bathroom, and kitchen, and a to-do list for before surgery.